Levulin Caristic, aminolevulinic acid hydrochloride for topical solution 20%, plus blue light illumination using the Blue U Blue Light Photodynamic Therapy Illuminator is indicated for the treatment of minimally to moderately thick actinic keratoses of the face or scalp. The following video will demonstrate how to apply the Levulin Caristic and operate the Blue U unit. Levulin Caristic and Blue U must be administered by a qualified healthcare professional. Levulin Caristic is not intended for use with any device other than the Blue U Blue Light Photodynamic Therapy Illuminator. This video will instruct you on how to properly prepare the patient for Levulin Caristic and Blue U, activate the Levulin Caristic, apply the Levulin Caristic to the lesions, position the patient within the Blue U, communicate post-treatment patient instructions. The actinic keratoses, AK lesions, that will be treated should be clean and dry before Levulin Caristic for topical solution is applied. Levulin Caristic can be prepared manually or by using the Caristic crusher. Manual preparation. Make sure the cap end of the Caristic remains up during preparation. Step 1. Hold cap up. Step 2. Crush point A. Step 3. Crush point B and continue crushing downward from point B to point A. Step 4. Gently shake for 30 seconds. Do not press on cap while shaking. With the cap still on, point the applicator end away from your face when shaking. Using the Caristic crusher method, make sure the cap end of the Caristic remains up during preparation. Step 1. Place the Caristic in the crusher with the cap at the open end of the crusher. Step 2. Close the crusher. Squeeze the handles together and crush the Caristic. Step 3. Remove the Caristic from the crusher and gently shake for 30 seconds. Do not press on cap while shaking. Once the Levulin Caristic has been prepared, remove the cap. Dab the applicator tip on a gauze pad until the tip is uniformly wet. Apply solution uniformly to the lesion surface. Application should involve either scalp or face lesions, but not both simultaneously. Levulin Caristic should be applied to only AK lesions and not to perilesional skin. Avoid mucous membranes and eyes. Apply the solution directly to the target lesions by dabbing gently with the wet applicator tip. Enough solution should be applied to uniformly wet the lesion surface, including the edges, without excess running or dripping. Once the initial application has dried, apply again in the same manner. After mixing, if the solution application is not completed within 2 hours of activation, the applicator should be discarded and a new Levulin Caristic should be used. After application, allow Levulin Caristic to incubate for 14 to 18 hours. Instruct the patient to not wash the treated lesions in between steps and to avoid sun exposure for at least 40 hours after application of Levulin Caristic. Prior to Blue U Blue Light illumination, gently rinse the treated lesions with water and pat dry. Both the patient and the medical personnel should wear appropriate blue-blocking protective eyewear during Blue U treatment. Position the Blue U around the face or scalp as follows. For patients with facial lesions, the Blue U unit is positioned so that the base is slightly above the patient's shoulder, parallel to the patient's face. For patients with scalp lesions, the knobs on either side of the Blue U are loosened, and the Blue U is rotated to a horizontal position. In all cases, The treatment area should be no closer than 2 inches and no further than 4 inches from the blue U surface. Illuminate the treated lesions with blue U for 16 minutes and 40 seconds. Common adverse reactions. Patients should be advised that the most common adverse events include scaling, crusting, hyperpigmentation, itching, stinging and/or burning, erythema, and edema. Severe stinging and/or burning at one or more lesions being treated was reported by at least 50% of patients at some time during the treatment. However, in clinical trials, these feelings appeared to reach a plateau at 6 minutes into the treatment. These feelings of discomfort should improve at the end of the blue U treatment and should subside between 1 minute and 24 hours after the blue U is turned off. If the blue light treatment is interrupted or stopped for any reason, it should not be restarted, and the patient should be advised to protect the treated lesions from exposure to sunlight or prolonged or intense light for at least 40 hours after the application of the Levulan Caristic for topical solution. After Levulan Caristic application, patients should be advised to allow Levulan Caristic to incubate for 14 to 18 hours and to not wash lesions during the incubation period. Wear a wide-brimmed hat or other protective apparel to shade the treated actinic keratoses from sunlight or other bright light sources for 40 hours after application of the Levulan Caristic. Reduce light exposure if the sensations of stinging and/or burning are experienced. Sunscreens will not protect against photosensitivity reactions caused by visible light during this time. Provide the patient with educational support materials to help manage their treatment expectations. Instruct the patient to apply moisturizers as needed. Inform patients that following treatment, their treated AKs and to some degree the surrounding skin may redden. Swelling, scaling, and itching may also occur. These effects, however, are temporary and should completely resolve by 4 weeks after treatment. Schedule a follow-up visit. To lock the head, rotate the head lock handle clockwise. To unlock the head, rotate handle counterclockwise. Use the arms to adjust the height of the head. Loosen the handles on both sides of the head to rotate the head to the desired position. Place post in storage mode prior to transporting blue U. Step 1. Lift latch. Step 2. Using the post handle, rotate post 90 degrees clockwise and release latch. Important risk information. Application of Levulan Caristic should involve either scalp or face lesions, but not both simultaneously. Levulan Caristic should not be applied to the periorbital area or allowed to contact ocular or mucosal surfaces. Excessive irritation may be experienced if this product is applied under occlusion. Contraindicated in patients with cutaneous photosensitivity at wavelengths of 400 to 450 nanometers, porphyria or known allergies to porphyrins, and in patients with known sensitivity to any of the components of the Levulan Caristic for topical solution. Levulan Caristic has not been tested on patients with inherited or acquired coagulation defects. It is possible that concomitant use of other known photosensitizing agents might increase the photosensitivity reaction of actinic keratoses treated with the Levulan Caristic. The most common adverse events include scaling, crusting, hyperpigmentation, itching, stinging and/or burning, erythema, and edema. However, these effects are temporary and should completely resolve by 4 weeks after treatment. During light treatment, both patients and medical personnel should be provided with blue-blocking protective eyewear, as specified in the Blue U operating instructions, to minimize ocular exposure. Please visit www.dusapharma.com for full prescribing information.